Welcome. Today we're going to explore a crucial, yet often overlooked connection between your bladder control and a vital nutrient, vitamin B1. Many people experience frequent urination, urgency, or even leakage, and are told it's simply a bladder issue. However, clinical insights suggest these symptoms are frequently rooted in a deeper nervous system problem, not just the bladder itself. Understanding this link is the first step toward regaining control. If you've felt frustrated by generic advice for urinary urgency, leaky bladder, or incomplete emptying, you are not alone. Many search for answers online, only to find repetitive, basic information that doesn't address the core problem. The reality is, after decades of practice, it's clear that bladder issues are often a symptom of a deeper nutritional deficiency, one that standard approaches frequently miss. It's time to look beyond the surface. When we think about bladder control, our minds often go straight to the muscles. We might imagine a weak bladder or an overactive one, but this perspective is incomplete. Your bladder is intricately controlled by a complex network of nerves. Think of it less as a simple muscular bag and more as a sophisticated system with delicate wiring. When this wiring malfunctions, the entire system struggles, leading to those frustrating symptoms. Deep within your brain lies a critical area called the periaqueductal gray matter. This region acts as the main control center for urine elimination. It's incredibly sensitive, and when it doesn't function optimally, the entire control system for your bladder can shrink and lose its effectiveness. This central command center needs specific support to maintain its vital role in regulating bladder function. The periaqueductal gray matter and your autonomic nervous system are highly susceptible to a specific nutritional deficiency, thiamine, or vitamin B1. Without enough B1, the neurons in this crucial control center cannot produce the energy they need to function. They essentially starve, leading to a loss of clear signals to your bladder. This B1 deficiency is a common thread connecting various bladder malfunctions, whether it's an overactive bladder or difficulty emptying completely. There's a strong connection between diabetes and bladder problems, with a significant percentage of type 2 diabetics experiencing these issues. This is often due to diabetic autonomic neuropathy, where high blood sugar depletes B1, damaging the protective myelin sheath around nerves. You don't need to be fully diabetic to be affected. Chronic insulin resistance, which impacts many, also depletes B1, directly degrading bladder control. Vitamin B1 is essential for converting carbohydrates and glucose into energy. If your diet is consistently high in carbohydrates, your body demands more B1 to process that fuel. This constant demand can deplete your B1 reserves, leaving your body, and specifically your brain's bladder control center, starved of this vital nutrient. It's like trying to run a high-performance engine on an empty fuel tank. To truly fix the root cause of bladder control issues, we must go beyond simply managing symptoms. We need a comprehensive approach. Our protocol involves 4 key steps. First, replenishing essential nutrients through targeted supplements. Second, stopping the depletion by making crucial dietary changes. Third, optimizing fluid dynamics and body chemistry. And finally, providing mechanical support and physical stimulation. This 4-step protocol is designed to address the underlying issues, not just the symptoms. By focusing on replenishment, dietary adjustments, chemical balance, and physical support, we aim to restore proper nerve function and, in turn, bladder control. Each step plays a vital role in rebuilding your body's natural ability to regulate itself. When replenishing B1, standard synthetic forms are often insufficient. A combination approach is most effective. We recommend benfotiamine, a fat-soluble version of B1 that effectively penetrates cell membranes to reach your brain and nerves. Alongside this, incorporate natural water-soluble B1. While you might notice improvements within 2 weeks, Severe deficiencies require consistent effort, typically 2 to 3 months, for full rebuilding. You cannot fill a leaking bucket. Continuing to consume high amounts of carbohydrates will constantly burn through your B1 stores, making it difficult to replenish them. The solution is to adopt a low-carb or ketogenic diet. This significantly reduces your body's demand for B1. To accelerate this process, consider implementing intermittent fasting. Reducing glucose intake allows your B1 levels to rise and gives your nerves the chance to heal. To further support your body's chemistry, especially concerning blood sugar and insulin resistance, consider a simple chemistry hack. Adding apple cider vinegar to water can be highly beneficial. This practice helps flatten blood sugar spikes and improves insulin sensitivity. By indirectly supporting healthy blood sugar regulation, you create a more stable environment for nerve health and overall bladder function. Beyond nutrition, mechanical support and managing irritants are crucial. Gently massaging the bladder area can stimulate tone and help ensure complete emptying, reducing residual urine. Equally important is controlling irritants like caffeine. While a small cup in the morning might be fine, excessive caffeine can negate your progress by overstimulating the bladder. Aim to reduce consumption to support your recovery. To summarize your path to recovery, here's a checklist. For supplements, combine benfotiamine and natural B1. For diet, embrace low-carb or keto with intermittent fasting. Regarding fluids, aim for 2.5 liters daily, stopping in intake by 6 to 7 p.m., and include apple cider vinegar. For lifestyle, reduce caffeine and perform manual bladder massage. Commit to this protocol strictly for 2 to 3 months for optimal nerve regeneration.